This is GMT ConceptCast with Nurse Liberty, where complex nursing concepts are made simple. Today, we're looking at the anatomy of the human heart. The human heart is a hollow muscular organ located in the thoracic cavity. It lies between the lungs and slightly towards the left side of the chest. The heart has an apex below and a base above, and for its size, it is about the size of an individual's fist. In an average adult, the human heart weighs about 225 to 310 grams. It is slightly heavier in males than females. So let's talk about the layers of the heart. The wall of the heart is made up of three layers, which are the pericardium, myocardium, and the endocardium. For the pericardium, it is the outer layer of the heart. It consists of an outer fibrous pericardium and an inner serous pericardium. The serous pericardium is further divided into parietal layer and the visceral layer. The visceral layer lies directly on the surface of the heart, while the parietal layer is the outer layer. Between the parietal and the visceral layer is a pericardiac space, and this space contains serous fluid. This fluid, what it does, it reduces friction as the heart beats. The pericardium, its major function is that it helps in protecting and maintaining the position of the heart. So let's go to the second layer, which is the myocardium. The myocardium is the muscular layer of the heart. It forms the bulk of the heart wall. It is composed of cardiac muscle tissue. The myocardium is usually thicker in the ventricles, especially in the left ventricle. This is because the left ventricle pumps blood throughout the body during systemic circulation. The major function of the myocardium is that it is responsible for the contraction and pumping action of the heart. So let's take the last layer, which is the third layer of the heart, and that is the endocardium. The endocardium is the innermost layer of the heart. It is lined by squamous epithelium or squamous epithelial tissue. This layer is continuous with the inner lining of blood vessels. So let's talk about the interior of the heart. Internally, the heart is composed of four chambers, and these are two atria above and two ventricles below. The heart is then divided into right and left halves by the septum. The right atrium is separated from the right ventricle by the tricuspid valve or the right atrioventricular valve. The left atrium is separated from the left ventricle by the bicuspid valve or the left atrioventricular valve. It is also called the mitral valve. These valves, the atrioventricular valves, they help maintain one-way flow of blood through the heart. Instead talking about the interior of the heart, inside the ventricles are special muscles called papillary muscles. These are extensions of the myocardium. They are connected to the valves of the heart by fibrous cord called chordae tendineae. These structures help to prevent backflow of blood during ventricular contraction. So we're speaking about the layers of the heart and the interior of the heart. So let's go further to the blood supply of the heart. The heart receives arterial blood through the coronary arteries, and these arteries arise from the ascending aorta. And then the venous drainage occurs, most of the venous drainage occurs through the cardiac veins, which empties into the coronary sinus. And that is all for today. See you in the next episode.